Hi everyone, Dr. Michelle here with Design to Heal, and back again for some more healing touch uh, teaching and educating. And this is going to be healing touch, what a session will look like. So if you schedule your session, some of this will be, well, if it's online, actually online. I don't know if I do it online, but definitely live. I provide healing touch, home care. I do healing touch online, excuse me, because I can teach people the method, and you can provide that on your friends and family. So I can provide a class with a group of people, or I can do just a private class and teach you for self healing touch or on friends and family. Or if you work with patients, I can show you some great techniques depending on what your focus and your goal is. So, just a little bit of logistics there. But if you are coming in live, this is typically what a session would look like live. So let's run through that. So there's about 10 different steps. The first step is intake and intake, which is and an update. So basically, I mean, getting the chief complaint, what the patient's concerns are. So what their main complaint is. Usually, if my patients tend to have a list of issues. As I've become a more advanced clinician, the list seems like it's gotten longer. So um, I usually have them do a priority list. So the number one chief concern, and then if they have more than one, typically it seems like I have at least 1 to 3 with my patients. But I'll have them list those out, and of course they can fill out their history form and all of that. So I'll have that to refer to. But asking some questions, doing an intake and an update if they're following up, and then let's see, I'm going to just go through this, making sure that you've got a consent to treat. And then number 2 will be, actually, let me go back to number 1. Actually, after number 1, and I do the intake and update, and we're going to get started, then it's considered like practitioner preparation, which you can actually do this before your patient even arrives for all types of treatments. So if there's any practitioners out there, you really want to find a few minutes before you're going to see your patient so you're grounded, because people feel our energy. And this has been something I've been challenged by many times because I'm running around, time management, and then just being able to get grounded before you see your next patient. So they can really sense energetics. And as I've, like I said, become a more advanced clinician, these tips of the trade have helped. So a way to get grounded is just by, you can even close your eyes, kind of like you're meditating. You can be seated in a chair. You can stand and then just take in a couple of breaths in and out. So let's take one just to get grounded for this video. And hold your breath. And slowly exhale. Now, I usually like to do at least 2 or 3 of those for myself to get grounded. I usually close my eyes because it helps me go within, create an intention of centeredness and calmness, and then creating that space for my patient. So, really getting attuned and grounded and centered for myself first, and then second, attuning and getting centered with the patient. So number 3, do a pre-treatment energetic assessment. Now, I don't really do this one. Some practitioners do, and it's with the pendulum, which can determine if the chakra field is closed or open. You can do a hand scan to assess the energy field and identify differences of flow. And that's what I do. I do an initial head to toe, hands-off assessment of their energy fields. And I usually will do a few passes of that, going head to toe and seeing what I can sense and feel in the patient's energetic fields. So that would be number 3. And then number 4, again, we're looking at health issues that the patient has shared, and this can be physical, emotional, mental, or spiritual. Usually there's a little bit of all of that. So excuse me a minute. Okay, so next is mutual goals. So we want to find out what's important to the patient, what is really what they want to create, and then the intentions for healing that have been identified by our patient, and then we support that as a practitioner. So that's where I really like to tune in and kind of, I'll have a set intention for the patient's greatest good in their healing, and I'll focus on what they've shared that's important to them. So that intention is really kind of, we planted the seed in our thoughts. The healing touch intervention then we'll jump in and use the healing touch intervention, the healing touch techniques, which I will be sharing in later videos. Now, if the patient is coming to see me, usually they are laying on a massage table and they are staying in their clothes, unless they're getting acupuncture and a massage along with it, other therapies or med spa treatment, then clothes will come off. Otherwise, they can stay cozy in their clothes, and I have a lot of nice heated cozy blankets and pads, and they can lay on the infrared heat chakra crystal mat for their therapy as well, to get that added boost of healing. So there's lots of ways you can set up a healing touch session. When I'm doing a home care session, the patient will probably be seated in a recliner or laying on their bed, wherever they're comfortable, and create that nice space. Also, when I'm doing it in the clinic or at the patient's in the patient's bed at their home, you can also consider using, like, having an eye pillow available. I have like a lavender heavy, kind of a light weighted buckwheat kind of eye pillow that sits on the eyes, or even just like a soft cloth to go over the eyes, to really go for the patient to go within, and helps them to get relaxed. So we're going to use the various healing touch techniques depending on what the patient has stated that their needs are, and what we have gathered from the energetic assessment. So what I've gathered from the energetic assessment. Now, the next part of this session will be the post-op, or not post-op. I've been doing surgical nursing for so many years, and surgery is always on the brain. So post-treatment energetic assessment. So reassessing the field and the chakra centers, the 7 different energy centers, and the different levels of energy that come off of the human body. So we'll do a post-treatment energy assessment and determine the effect of the intervention. This can help us also to gather information. Oh, this area still needs to be cleared. I'm feeling maybe some sensation of tingling or an obstruction or some heat. There's various sensations of temperature, of like prickling, just different sensations that practitioners feel that they pick up with the different energy centers. So depending on that, then you can tune into that specific area and still go back and do a little bit more therapy on that area to clear it out and get things moving. So then the next part, we're kind of moving towards the end. I've focused in now on the chief complaints, the primary concerns of the patient, and I've focused on those areas of the body. So say if they have pain in the shoulder, I've worked on that shoulder, draining the pain. and getting circulation, energy flowing, obstruction moving out of the body. So also, this can also, just to go back on that, this can be a great way also just to move toxins out of the body, a detoxing kind of the body, with working kind of from a head to toe. We're releasing toxins. So our next step is grounding and releasing. So we're grounding. We can do that by holding the patient's feet. And I like to do that in quiet first, just to ground. Like I said, I'm usually also incorporating a little hand massage and then foot massage to ground. And that can be with or without essential oils. And then that can provide an added boost to the health concerns as well. If they have insomnia, we could use some oils that are great for insomnia. And then when I'm doing the holding of the feet, I don't really do this, but you can start to talk to your patient. I'm kind of still doing some more releasing and mentally clearing of the patient, and clearing energetically, kind of working kind of a closing, passing of the fields. And like I said, making sure that I've done all the areas that my intuition and that the patient's needs have called for. So at the end, I'm going up usually and doing more grounding, excuse me, up at the kind of the upper portion of the body, and I'm holding and connecting, maybe a light touch on the elbow, the wrist, the shoulder, and the elbow, and kind of doing a grounding technique that way. And then once I've done that, then I'm communicating with the patient to get the patient's verbal response and feedback of what did they experience, what did they notice, tell me more type of thing, so I can really tune into what they experienced and what we created in the session. So let me see if there's anything else on that one. Again, you can look at the patient and note pretty quickly, usually when I'm doing healing touch, the presence of relaxation response, because that happens pretty quickly. So, and they'll usually also, when you ask them at the end, share your experience, that's usually always one of the experiences that they've had, is getting calmer, relaxed, maybe even falling into a slumber, which is really amazing. It's those snoring patients that get amazing results. And then the degree of relief of the symptoms. So a lot of time, or most of the time, I am doing, if we're, whatever the complaint is, I'm usually scaling that on a numeric pain scale from 0 to 10, 10 being the worst. So I'll have that in the beginning and the intake when I'm taking notes. And then at the end, before they leave, we can ask them, okay, where are you now on the scale 1 to 10? And get that degree of relief of symptomology. And then the next, lastly, the last step is just planning going forward, growth work. So, getting them in the calendar to set them up for success with regular treatments. More is usually better in the beginning, especially if we're working with chronic issues with patients. They're going to want to come more in the beginning. And if you watch my effective treatment planning video for acupuncture, that can go along pretty much with all the different therapies that I do, a lot of them. So please watch that. It's called Effective Treatment Planning Video, and that is in my Oriental Medicine playlist. And then I also did a backup video just recently on consecutive days treatment. So you could even consider coming in consecutive days if you want to really work on resolution of an issue. That's another idea. So planning growth work, I always say, and I've learned this through my self-development coursework over the many years, if it's not in your calendar, it's usually not going to probably show up. So I like to calendar in, like, so for like my healing sessions for myself, or really anything, I'm planning 6 months in advance if I can, or at least quarterly, and getting that into my calendar. Like for my acupuncture, I usually like that twice a month minimum. So I'm booking that out 6 months in advance. I know what days work for me, and those are my non-negotiable days. That's my Dr. Michelle's healing time for me, because if I don't get healed and stay grounded and well, I can't be there for others. And then the weeks that I'm not getting my acupuncture, I'm filling that in with my couple hours of massage healing. And again, I'm booking out in advance, 3 to 6 months in advance. And that's my non-negotiable time, and that's my time. So I can be there for you guys powerfully. So again, planning with the patient, you can, consider any recommendations you might want your patient to do, journaling, various, nutrition, lifestyle suggestions. And then you can also consider other referrals if you think other referrals could be helpful. Self-care, again, we're looking at lifestyle and nutrition. And then teaching your client, education. That's why I started this platform on YouTube, to educate your patients and get the word out there about all the different modalities of healing, areas that we can look at to really nurture and expand our growth. And then that is about it. I already talked about appointment setting, so please look at that video that I expressed. All healing touch techniques may be used alone or in combination with other techniques. And that's what I'm going to teach you, is individual techniques on my demo videos that I'll be getting out soon. Most techniques can be done either sitting up, lying down, or in a reclining position. So when I can move post-surgically in the next, it's going to probably be a week and a half, 2 weeks from now, I'm going to be doing a lot of self-healing touch on myself to really just, speed up my recovery. That's one of the things I'm going to do. So I hope that you liked this video and that gave you an idea of what a healing touch session can look like. And then also knowing that we can do that online by self-teaching and taking these tools with you. So stay tuned for Dr. Michelle's demo videos showing you individual techniques of healing touch and what those can do and provide in healing certain areas of the body. There'll be one that you'll really want to stay tuned on, because most people seem to have pain or know somebody that has pain. And I'm going to be showing you a pain technique, which will be very wonderful and effective. So please push the thumb if you like the video and subscribe. It is free to subscribe to my channel. Share and give the gift of healing with my channel, please, to really help to empower patients around the world to know that there's really an limitless amount of therapies out there, more than a handful or two, handfuls. I have so many tools in my toolbox, being in the medical field for so many years, that I always have something to share with the patient, that I'm never running out of ideas. However, I might not be the right fit, and I can refer them out for other professionals and other modalities that they can try. So just know that there's always hope, and there's always other options to resolve your health challenges. So stay vibrant, stay healthy, stay cozy. And I'm here for you if you need me. So please reach out, email me, or leave a comment or a question. and I'll look forward to seeing you soon. Okay. See you, everyone. Sending you love and healing. Ciao.